Hi everyone, welcome. Chapter 13 on therapies is my other favorite chapter because I'm a clinical psychologist by training. And so this chapter is again where we see the entire field of psychology come together as a science and a practice, and that's what clinical psychologists do. Today, in our semester, we complete this theme I called When Things Go Wrong, featuring topics such as psychological disorders and psychotherapies, which is this chapter that we're on right now. Now, this chapter has a really positive outlook as we turn to studying how we help people who struggle. Psychology is a helping profession, one of the features that attracts many students like me and makes psychology one of the most popular college majors in the United States. In this Therapies chapter, we study mental health professionals, that's psychologists and psychiatrists primarily, who are using multiple strategies and processes to help individuals recognize, define, or diagnose their psychological difficulties and then overcome through therapies and improve their overall adjustment in the short term and in the long term. Now recall that two steps are common in the treatment of almost all psychological disorders discussed in our last chapter. Number one, medications come first to immediately help the patient in distress when they show up at the clinic or the hospital. And medications are considered a short-term solution. So long as someone stays on those medications, the symptoms of the disorder should be controlled. But it is not considered a long-term solution. And that leads us to step two. Step two, talk therapy comes second. And it's considered a long-term solution to truly cure the patient and the underlying psychological disorder and try to prevent this disorder from ever happening again. So the psychotherapy plan is to see improved or increased coping skills in the patient so that we can decrease the need for medications. Eventually, we want to taper off the medications so that I just don't need them anymore. Successful and complete talk therapy results in a patient gaining the coping skills to handle life's challenges now and in the future, without the future need for medications or further mental health treatments of any kind. As you read this chapter about different kinds of talk therapy, keep in mind how exactly psychotherapy works. Psychotherapy is three tasks. Task number one, we talk a lot. Question and answer, a lot. We discuss problems, and psychologists discuss the originating thoughts, subsequent feelings, and then how this can turn into unhealthy behaviors that the patient does not like. Remember that talking by itself provides a release for patients, kind of getting it off your chest. Most report it feels good to be heard and accepted when they struggle. Second task, all patients inevitably have patterns in how they react to other people and situations. Recall personality a couple of chapters back, right? Personality was defined as the characteristic way of responding. Well, we look for that in psychotherapy. Psychotherapists look for unhealthy patterns and try to determine what those patterns might mean, often looking in one's past life, past relationships, and even as far back as childhood relationships with parents when it seems relevant. And then the third task of psychotherapy, we want to help the patient, of course, find better or other ways of achieving one's goals, other ways of living one's life and having healthier relationships, happy relationships. Again, be sure to watch the videos in this chapter where you'll hear these three tasks and see demonstrations of various types of talk therapy. Fascinating therapies to talk about in this chapter as we continue our theme called When Things Go Wrong. I think you'll find this chapter really, really interesting. Let's get started.